I'd like to talk to and inform you about preeclampsia. In my family, the women have a tendency to develop this complication during their pregnancies, and as the trend goes, I myself developed a mild form called gestational hypertension. Preeclampsia is a pregnancy complication that affects 2 to 8% of pregnancies worldwide, according to marchofdimes.com, and this is about 2 to 8 in 100 pregnancies, marchofdimes.com. Of the premature births in the United States, preeclampsia is the cause of 15%, marchofdimes.com. Given this statistic, it is a condition that must never be overlooked and important to be educated on. I will share with you what this condition is, how it is diagnosed, the effects it may have or could have on the mother and the baby, and how it is treated. So some definitions I'm going to use include high blood pressure, which is a blood pressure that is 140/90 or greater. Premature birth is a birth that occurs before 37 weeks of pregnancy, and placental abruption is a condition where the placenta separates from the inner lining of the uterine wall prior to birth. Now, what is preeclampsia? Well, according to Mayo Clinic, preeclampsia is a complication characterized by high blood pressure and signs of damage to other organs and systems, often kidneys. Now, preeclampsia usually occurs after 20 weeks of pregnancy, and preeclampsia is marked by high blood pressure as well as a high level of protein in the urine. Some other things you may experience are swelling of the hands, feet, or legs. Now, some other things that also come along with preeclampsia are rapid weight gain, which is about 5 or more pounds a week, abdominal pain, which is normally in the upper right quadrant, severe headaches, changes in reflexes, reduced to no urine output, dizziness, excessive vomiting, and nausea, along with vision changes. However, according to mayoclinic.org, preeclampsia sometimes develops without any symptoms. Now, how is it diagnosed? Well, your health provider may want to monitor your blood pressure and check your urine for protein at every appointment. To diagnose preeclampsia, you must have high blood pressure as well as at least one of the following: protein in your urine, a low platelet count, impaired liver function, and symptoms of kidney function trouble other than protein being present in the urine, fluid in the lungs, new onset headaches, as well as visual disturbances. Now, if your healthcare provider suspects that you may have preeclampsia, certain tests such as blood tests, urine analysis, fetal ultrasound, and non-stress test or biophysical profile may be required to monitor the severity as well as the effect it is having on you and your baby. Now, what effect does preeclampsia have on mom and baby? Well, preeclampsia can prevent the placenta from receiving enough blood and oxygen, which means the baby is receiving less oxygen and fewer nutrients, which can cause growth retardation and cause low birth weight as well as premature birth. Preeclampsia increases your risk for placental abruption, which can cause heavy bleeding and damage to the placenta, which in turn affects the baby greatly. Preeclampsia can also lead to HELP syndrome, which stands for hemolysis, elevated liver enzymes, and low platelet count. Also, if preeclampsia goes untreated, eclampsia develops, which eclampsia is similar to preeclampsia. However, it has the addition of seizures, which seizures are bad as they can cause lack of oxygen to the mom and in turn to the baby. Now, having preeclampsia can also increase your future risk, that being the mother, of cardiovascular disease later in life. To treat preeclampsia, the only cure is to deliver the baby if the mother is 37 weeks or greater into her pregnancy. Or if you are not close to term, being 37 weeks, your doctor may want to treat the symptoms you're having until you are closer to term, in which you can be either induced or go into labor on your own. So some of the treatment would be bed rest, frequent ultrasounds and fetal heart rate monitor, medication to help lower your blood pressure, as well as frequent blood and urine tests. So to review, we have covered what preeclampsia is, how to diagnose it, the effects it has on mom and baby, as well as how it's treated. As the causes of preeclampsia are uncertain, we can only hope to educate ourselves on the complication and practice a healthy lifestyle during pregnancy. Or, if you're the significant other, promote this in hopes that we can catch it before it's too late. This is a serious condition as it can have lasting effects on the mother as well as baby if not properly treated. If you do not seek attention and allow it to develop to eclampsia, this causes seizures, which is no good for neither mom nor baby. Moreover, this condition can have lasting effects on the cardiovascular system and can lead to potential conditions later in life, such as chronic hypertension, etc.